Hello and welcome to a brand new episode of your AKT Podcast, which is hosted by WellMedic.co.uk. As a new feature on our podcast, from time to time, we will be speaking with WellMedic GP trainees that have passed the AKT. This is our latest effort in bringing you the best and most genuine advice possible on the AKT. In our very first episode, I am joined by Dr Hashim, a newly qualified GP who has recently achieved her MRCGP through the Pennine GP training scheme in the northwest of England. This is a really interesting chat with a trainee who initially failed the AKT by a single mark, and unlike many, she waited 12 months before retaking the exam, to then pass with flying colours. Dr Hashim is also an international medical graduate, and she shares her experiences on how the AKT poses its very own challenges for IMGs. I kick off this podcast by asking Dr Hashim what she's currently up to.
Thank you, Sham, for inviting me for this podcast. I'm a recently qualified GP from the Pennine Acute Trust, Northwest Deanery, and I finished my training end of April after my RCA results came out. And at the moment, I'm doing a salaried post in intermediate care at Rochdale Infirmary. And apart from that, I do sessional work in different surgeries, just trying to explore the areas around and how the GP practices work. And once I get to know them, then hopefully I'll settle in a more permanent role.
Okay, fantastic. And how have your first couple of months been as a GP?
I think it's both exciting as well as daunting, because you're on your own. It's more responsibility, and you don't get the same guidance as you get when you're an ST3. But it's good to have some independence as well, I believe.
And what was your training experience like? Did you do it as a kind of full-time trainee or a part-time trainee?
It was kind of a mix, in some of my hospital rotations, I was 60%, and then 80%, and then I went to full-time. And in my ST3, I started as a full-time trainee, but I thought it was too much for me because I've got a young family as well. So I went to 80%, and it worked really well for me because ST3 is quite an intense year, because I did both my exams in that year. And then you have to maintain a portfolio. You have to worry about your ARCP. Your workload is increasing. So there were quite a lot of things going on in ST3. So I think it worked for me to take some time off for myself as well. So that's how it worked good for me.
Yeah, no, you're absolutely right. I think finding that balance is quite difficult, and it will be quite interesting to actually touch on the difficulties of actually trying to complete training programs with having a young family, because I think that's sometimes overlooked. Now, when you say you kind of did you did both exams in ST3, was that your first sitting of the AKT in ST3, or had you taken it in ST2 as well?
No, I took the AKT while I was in the intermediate care as an ST2, and that was my first sitting. But I gave a gap of about a year because the last sitting was in October 21, and I just failed by 1 mark.
Oh my goodness!
Yeah, it was quite frustrating, and it was quite desperate situation for me at that time. So my supervisor, he advised me to just give it some time, settle in as an ST3, because you need to learn so many new things in the general practice. And so I took his advice and resit in October 21. Sorry, are we missing the first sitting was in October 2020. Yeah, 2020, and the next sitting was in October 21.
Okay, that makes sense.
Yeah.
So you had a good year between and actually, that's quite insightful actually, as to taking that gap, because from my experience, I tend to find that sometimes after failing once, you kind of rush into that second attempt, especially when you're kind of 1 mark away. So that's interesting. And when in that year that you had leading up to the second sitting of the AKT, what did you do? Did you kind of take some time off before you started revising again, or did you very much kind of start your revision process immediately after that kind of first fail?
I think I took just a month's gap, and then I restarted. But obviously, it wasn't like in full flow, and not revising every day like we used to do in the first sitting, like 3 months before the exam. It was an everyday revision, but for that second attempt, I gave it some time in between, and then restarted.
Mm-hmm. So you
Yeah.
kind of you paced yourself maybe a little bit better than that first attempt.
Yeah, I would say so. Yeah.
Mm-hmm. And before we talk about kind of how you revised and what your approach was, and the contrast between the approach between your first and second sitting, what would be quite interesting for me to understand is, in the experience that you've had from taking the AKT, failing by a mark, which would have been extremely frustrating, then having to wait another year before taking the exam again, how is that? What type of impact has that had on you as a GP now?
I think you get more confident, you're more sound in your knowledge, and you obviously study more, you look into different things, so it gives you a good experience, I would say. Because if I had passed in the first attempt by chance or by luck, by getting that 1 mark, I wouldn't have gathered more knowledge and more information, or I would say that it was a good experience. And obviously it was the application of the knowledge, which helped me to be a better GP, I would say.
And then did that help with the RCA sitting as well? Because
it does. Yeah, because the knowledge is quite fresh in your mind, and obviously when you're consulting, things come back in your mind, and then you just talk to the patient, with the latest guidance. So I think that gives you an edge as well, just to take both exams like side by side.
Yeah, that's quite interesting, because I think that's a discussion that I was having with one of the local trainers to where I currently work, and they were saying it's often very difficult, and often it's very much based on a trainee as to whether they will be able to do both exams close together, or whether it's someone like myself who you got the AKT out early, and then you wait good 12-18 months before taking the RCA, and actually you are right, then you have to then still refresh that refresh yourself that you're up to date. So that's really interesting. So in terms of the contrast between the first and second sitting, what would you say the main differences were in terms of how you then prepared for the AKT?
I think I had a bit of a tunnel vision when I was revising for the first time. Like I was sticking to one resource, which was past medicine, and then this GP self-test. These were the only two things that I was looking into, and I was just studying on my own, like in my own time. And some days I would feel like studying after hectic day of work, and some days I wouldn't feel like studying at all. But in the next sitting, what we did was that we found a very nice group of people from 14 Fish, and we used to do Skype calls at night time, and we had to make sure that every one of us is there and everyone is contributing. So we would revise the questions, we would discuss the guidelines, we would discuss how to do stats, how to do admin. So I think that was quite helpful for me, although I had never done group study before, but I really enjoyed that, and I think it was a very helpful experience for me.
So talk me through kind of what a kind of typical group setting would look like. So how would it function?
Yeah, in terms of group, since we were 6 or 7 females, all with young families, all doing hospital rotations, and some of them were like myself, we were ST3s. So we would like set up a time at night time, for example, 9 to 10, that we will come on the Skype call. And then we would, open up past medicine. We would open the GP self-test and the NICE CKS guidelines. And, whatever question would come, we would try to relate the answers. We'll try to figure out the answers ourselves first. And then we would look into the resources to get a proper answer.
Mhm.
And what we would do is that we started creating our own kind of books, AKT books
Mhm.
in past medicine, because there are some, there are different boxes. We would
Yeah.
just copy paste the NICE guidelines on those boxes, and next time when we would revise, we'll have all those information there.
Okay. Okay.
So
So
that's how it worked for us.
fine. So in effect, to just summarize that, you
Mhm.
would use the questions as a base,
Yeah,
and then based on the themes that you were encountering, you would
yeah,
then go and look at more primary resource guidance to try and
yeah,
see what else you could learn about that particular topic. Is that correct?
yeah, yeah, yeah.
Mm-hmm. And in terms of like that approach, was that would you say the stark difference was that you were kind of extending your reading beyond what was in a summarized, let's say, past medicine textbook or a question
Yeah.
bank answer? Mm-hmm.
Yeah, I think that extended a lot, because initially when I did past medicine, I was just reading the questions. If I get the answer right, that's fine. If I
Mm-hmm.
don't, I would just read the text which was written down below. But I think AKT is more extended, but
Mm-hmm.
much more than what's written in past medicine. So
Yeah.
you have to look at the authentic resources, and you know, and there is a lot of collateral learning as well in AKT. I would
Yeah.
say you can't have a tunnel vision. You have to think laterally.
Yeah, and I think that's correct, and I think that's why kind of broadening out and asking or being inquisitive about what you're learning is really, really
Yeah,
important.
yeah.
Now, in terms of like one of the things I appreciate, much like yourself, is that
Mhm.
you have to use question banks. Like you
Yeah,
have to practice answering questions, but
yeah,
as you mentioned, the questions aren't necessarily similar to what's being asked in the AKT. Now,
yeah.
what would you say the biggest difference is in terms of how a question is asked in a question bank, like past medicine or
Mhm,
self-test or on exam or
mhm.
whatever it may be? How would that differ to the way that the questions are asked in the AKT itself?
I think a GP self-test is more close to the real exam.
Mm-hmm.
Because past medicine questions, they're quite simplified questions, and you already know what they're asking.
Mm-hmm.
Uh,
Mm-hmm.
but in terms, especially for the IMG doctors, I would say, since I am an IMG myself,
Yes. Mm-hmm.
you have to really understand what they're asking in the real exam.
Mm-hmm.
You have to give it a second thought what they're asking. It's not a very straightforward question. So
Mm-hmm.
you have to understand the question first and then give the answers, because most of the options, they're quite close to each other. And if you don't read the question and don't understand the question very well, then you can get confused in the exam, and you don't have enough time to rethink or keep thinking about it. So your reflexes should be really sharp in reading and understanding the questions.
Mm-hmm. And then trying to do that in a time-effective
Yeah,
manner
yeah,
is then another challenge. I've rarely
yeah.
met somebody who comes out of the exam saying, I finished half an hour early or an hour
Yeah,
early like you do in other exams.
yeah, yeah,
No, it's just quite interesting. And just to add to that, I guess that's where the differences between, let's say, first line investigations or diagnostic investigations.
yeah, yeah,
It's subtleties like that can often catch people out.
yeah,
If you read it as first line, there might be a stark difference between what's first line in a presentation,
yeah,
what's
yeah,
diagnostic in a presentation
yeah.
is. Yeah.
So you
Now,
have to look for those words that stand out,
mhm.
which is the most important thing, or something like that.
Yeah, yeah, yeah,
As you mentioned rightly, that first line or the gold standard,
yeah.
so you have to be careful when you're reading the questions.
Yeah. No. That I completely agree with you. On that basis. Now, in terms of the AKT itself,
Mhm.
like one of the things that I come across quite a lot, and actually based on our AKT report that we're due to publish very, very soon,
Mhm.
we found that 1 in 3 GPs feel, or GP trainees have felt, that the AKT was an unfair examination, an unfair assessment of their knowledge. How do you feel about that, or what do you feel of now hearing that actually 1 in 3 trainees feel it's unfair?
Sometimes it does feel unfair, um, because sometimes they are just asking like secondary care questions, which we might not be aware of.
Mm-hmm.
Um, but I would say that, it's quite a standardized exam as well, and as a GP, I think you need to have that knowledge. You need to have that kind of experience. So I would say that it's not too unfair.
Mm-hmm.
Um, I would say it's still a fair exam because a GP needs to know a lot of things.
Yeah, and one of the points that we covered in our course is around secondary care investigations, because actually
Yeah,
very rarely does the AKTs allow you to just say refer a patient. I'm not
yeah,
sure if you found that yourself. A lot of the
mm,
time it's not refer, it's what investigation is this patient likely to have. So
yeah,
let's say there's a patient with a change in bowel habit over the age of 60. It's not
yeah,
just straightforward enough to say refer to secondary care on a 2-week wait referral.
yeah,
um, it might be that the first line investigation might be a fit test or a full blood count, and actually the diagnostic investigation is going to be a colonoscopy or a CT
yeah,
colon. So
yeah,
I completely second what you're saying, in the sense that you are right. We often get frustrated by the fact that we're asked about secondary care questions, but
yeah.
I think there is a relevance to understanding what happens in secondary care once you refer a patient, right?
Yeah, because as a GP, because patients are expecting you to explain to them.
Hmm.
They might not get the right answers in the secondary care. We
Hmm.
come across a lot of patients who come and they said they had no idea what they're going to have when they
Yeah.
go to the hospital.
Hmm.
So they expect us to tell them, so it's good for us as well
Yeah.
to
Yeah.
develop that relationship with our patients,
Yeah. Yeah.
to inform them well what are they going to have, when we are referring them to the hospital. So they don't have that fear of unknown, so
Yeah.
they know what's going to happen there.
Yeah,
So
it's like that classical meds request, isn't it, of patient
yeah,
requesting diazepam for an MR scan because nobody
yeah,
told them that it was going to be in a very
yeah,
narrow tunnel and they're
yeah,
claustrophobic.
yeah,
So in terms of, I hope you don't mind. I really want to
mhm,
touch on your experience as an IMG, as an
yeah,
international medical
yeah, yeah,
graduate, because I do believe there is a difference in terms of
mm,
an experience of an IMG to say a UK graduate, in terms of
yeah,
how you feel about some of the examinations from the RCGP.
yeah.
What would be your key piece of advice to give to somebody who is an IMG student that's taking the AKT and possibly has had some difficulties with it first time around?
Um, as I said, that you have to broaden your canvas, and you have to look at different resources. As an IMG, we had this habit of just taking one book and reading. For example, for anatomy, we
Mhm.
would pick up one book and just you know go for the exam after reading that book only. I
Mhm.
think you need to have different resources and different reference books and places to
Mhm.
broaden your knowledge and to prepare for exams, especially for something like applied knowledge test.
Yeah. Yeah.
And for IMGs, I think the main challenge is the social setup. We think differently,
Mhm.
so we have to make sure that we are appropriately informed about the culture in the UK and what the patients are expecting from us, and all those kind of things
Mhm.
which are different. So that helps with the exams. It's not about the AKT, but I felt that when I was sitting the MSR exam and
Mhm.
the SJT part of the MSRA would come, and we had no idea how to attempt that. But I believe the UK grads, they were trained to attempt that SJT part of the exam right
Correct.
from the first year of the medical school,
Yeah.
or even before that, I would say in their A levels.
Yeah.
So I found that was the difference. It's sitting in the exams here,
Mhm.
and as I said, just broaden your scope of revision and use multiple resources. And there are certain resources like in gov.uk website, for example, for statistics,
Mhm.
which we weren't aware of, and obviously we would never study statistics like we did for AKT back home. So there are quite different aspects in an exam.
Yes.
So
Yeah.
you have to learn to adapt to those aspects and learn how to attempt the exam.
Yeah.
I think.
So that's really helpful, and I think what
Mm,
kind of naturally from there, I think we
mm.
kind of marry ourselves up nicely to the kind of organizational and practice
Yeah.
management, so admin, and as you mentioned, evidence-based medicine as well, so
Yeah.
statistics. Now, I know that you were a user of the WellMedic platform and you used the
Yeah.
admin
Yeah.
and statistics course. Um,
Yeah.
what would you say your experience was of preparing for those two sections? What was that like?
I think I'm not saying it because I'm talking to you,
Hmm.
but I found that your statistics understanding and the way you would teach or describe how to interpret the data when it comes in the exams, it was the most realistic and most closest to the exam, to the real exam. And you must have heard from other trainees that these days it's not just the formulas that you would learn, that specificity, sensitivity, all those kind of things.
Hmm.
It's more of data interpretation. You need to learn how to interpret a graph, or to interpret the data. And I think the way you tell, it's very nice and very understandable.
Thank you, thank you. I do appreciate that. No, I wasn't just fishing for a compliment there, of course. Um, but really, I really would like to know more about
Hmm.
the, how you mentioned that you maybe don't do statistics in as much
Hmm.
detail when you graduated from
Hmm.
Pakistan. So you
Yeah.
graduated from the University of Rawalpindi.
Yeah.
Now, in terms of like statistics itself,
Hmm.
what do you feel about statistics? When you first had to encounter evidence-based medicine as a area that you were going to be examined on, what was your initial thoughts about it?
Um, I didn't, I found what's the cause for, what's the reason for this kind of assessment? What are we
Hmm.
going to achieve with this? We don't talk to the patient like in those numbers and, in statistical, terms.
Terminologies. Yeah,
Yeah.
yeah.
Um, but in real life, I think when we are describing patients, what are the risks and, relative risk and all those kind of things, they do come up in the conversations.
Hmm.
So I think it was really helpful, and it was really helpful for us to understand what's the prevalence of things, and, how different diseases present in one area. And, you know, obviously, if the government is keeping those statistics, those numbers, they would be of relevance to our general practice.
Yes, I agree with you in that, and I think what's quite interesting is, when it comes to statistics and it comes to graphs, I think COVID is a really good example of this, in the
Exactly.
sense
Yeah.
that
Yeah.
you get lots. We were being thrown stats left, right, and center.
Mm.
You were being told about what the mortality statistics were, for example, or what the
Yeah.
infectivity statistics were,
Yeah.
and patients were talking about absolute risk and relative risks of
Yeah.
the benefits of immunizations, for example. And I
Mm.
think one of the things that I think is in terms of preparing for stats,
Mm.
you almost have to have a degree of interest in picking up journals and
Yeah.
start to look at actual graphs and
Yeah.
see whether you understand what's being presented to you. And that's one
Yeah.
of the difficulties that I personally had when I first started to prepare. I don't know if you came across kind of similar challenges.
Yeah, it was quite similar. And you mentioned graphs in those journals.
Hmm.
I think it's a part of the puzzle in which you're trying to improve the quality of care that we provide in the
Hmm.
NHS. So it gives you a good comparison of how well one practice is doing or how well one trust is doing. So all those things are quite relevant to the healthcare system we are working in.
Hmm.
So I think it was a good experience, although we hated stats at that time when we were reading it. But
Yes. Yeah.
at times it was quite interesting to know as well.
Yeah, no, it's true. It's one of those things that at the time you're just like, oh my goodness, when is
Yeah.
this going to end?
Yeah.
Again, I think one of the really interesting things or important things that I've learned over the last couple of years of doing WellMedic is that
Mhm.
actually stats and admin can often be the make or break between somebody failing
Yeah. Yeah.
AKT.
Yeah.
Um,
Sure.
I don't know if you find that actually preparing for clinical is just so vast, whereas actually stats is fairly specific in terms of what you need to know.
Yeah, that's absolutely true. And I would say that, most of my marks improved in the second attempt in stats and in admin.
Mm-hmm.
In terms of admin, I would say I was working as an ST3, and most of the admin was related to the general practice. So I learned on the go, like on job. I was learning loads of things. So that improved my admin marks. And obviously, stats, you rightly said, it's not a very broad subject. They're not asking you too many like details. They know, it's quite repetitive, and if you know the basics, then you can easily attempt those questions.
Yeah, no, absolutely. And again, really, really, really important point of using your experiences as an ST2, ST3 when you're in your GP placements and applying that knowledge into the exam scenarios as well. So, it's been a real pleasure actually speaking with you, Dr. Hashim. I think I've learned a lot, and it's nice to see that we're on a similar wavelength as well in terms of what we think about the exam. And now, just to finish off, I just have a very few questions that I would like to ask you, and all you have to do is select one of the options, and hopefully we'll be doing this with all our guests that join us on the podcast. So the first thing I would like to ask you is, do you prefer remote consultations or face-to-face consultations?
Face-to-face, because I love seeing patients. To be honest, I get a lot of assessment by just looking at them.
Yeah. No, I completely agree. I think face to face. Although sometimes it's nice to
have a break.
or just use a telephone consultation just as a bit of a breather or catch up slot in the slot. Now, in the next question, you've already told us kind of where you're at the moment, but would you rather work in a salaried locum or partnership role in the long term?
I would stick to locum because of the flexibility that I achieve. And as I said, I've got a young family. If I'm committed to a role, sometimes it gets hard to fulfill both commitments at home or at work. So I think locum is the best way forward for me.
Yeah, it's nice to have a long holiday as well, of course, when you need to with the kids, and they'll soon grow up. Absolutely. And last question. Of the two exams that you've taken, the RCA or AKT, which one would you prefer if you had to take it again?
Oh dear, that's a hard question. I would say none of them, but RCA, I would say. Yeah, because I passed that in the first attempt, so I think RCA.
And it wouldn't take another year of stress and heartache, nighttime Skype calls to prepare. It would be easier. No, honestly, it's been an absolute pleasure speaking to you today.
Same here, Sham.
I really appreciate the time that you've taken out, and I'm sure our podcast listeners that generally are used to listening to clinical content from ourselves will find this really, really useful. And it's another voice speaking on the AKT, which is what we want. And I would encourage anyone who's listening to this podcast, if you have any comments or you have any thoughts, if you'd like to feedback to either myself or to Dr. Hashim, then please do get in touch. And you can do that via email if you email sham@wellmedic.co.uk. Thank you so much for listening, and we will catch up again in another podcast episode. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.